Brissa, thank you. One area that many men tend to struggle with is taking care of themselves. You know, research shows that men are 200 times more likely to die from cancer, 50% less likely to have a primary care provider, and 50% less likely to seek mental health help. This morning, I'm bringing in Dr. Lee Ponsky with University Hospitals to talk about a new program that's aimed at getting men to go to the doctor. So great to see you. Thanks for coming in. But the bottom line is men just don't go to the doctor, do they?
Men are not as good at women as women are as going to the doctor. Women do a much better job, not only themselves, but even trying to get us to go, men to go into the doctor.
I heard you say once to me that you want to get it to be like a seatbelt, right? Like where men, you know, when you get in the car, you want to put that belt on.
I use the analogy, the seatbelt analogy, because growing up in my mom's station wagon, the seatbelt was, although they were there tucked in under the seat, it was really my mom's arm across my chest that was the seatbelt. But over the last 40-some years, things have changed. And although laws have changed, behavior has changed. And we know that if we could get men, and women do a much better job, so we want everyone to go to the doctor once a year, get checked, for sure. But in general, women do a better job. But men do such a lousy job at going to the doctor that if we could change behavior and every man went to the general doctor once a year just to get screened, the amount of disease that we would pick up early and the amount of lives that we would save is astronomical.
Incredible. So what are you guys doing right now to change the narrative, to make it better?
So we created what's called the Cutler Center for Men, which really is to focus on this aspect of how can we really bend the curve of getting men to go to the doctor. There's a lot of men's health programs out there that might focus on men who have difficulty urinating or prostate cancer or erectile dysfunction or fertility. We go way beyond that. It's really a fully encompassing program that's really trying to change the behavior of men and try to figure out what different things can we do to attract men that makes it less intimidating and more encouraging for them to come in and get checked every year.
So you want, when you're a boy, you want that boy to just have it instilled in them that they're going to keep going throughout their life.
Well, that's the thing, is so young boys go to the doctor because often their parents take them. So if you look at the pediatrician visits, boys tend to go every year. But then around the age of 20, 21, 23, it really drops off. So one of the aspects of our program is, can we change that behavior early on? So can we, when the boys transition from going to the pediatrician to adult doctor, can we change the behavior so they know every year they go to the doctor, it's just what they do, and it's just a learned behavior so that they go every year. So if we can change that behavior early, we know throughout the rest of their lives they'll keep going, and we're gonna pick up disease and save a lot of lives.
Let's dive into the Joe program.
Yeah, so another aspect of our program is we've realized that a lot of people, probably like myself, know they need to go to the doctor, but often get busy, and I thought I just went last year, but really I have gone for 2 years, and just life catches up with you. We all have part of that problem. We realize that if you have a navigator, and we call it our Joe program, kind of an everyday Joe, it's just your buddy Joe, he's there for you. So you get a Joe, it's free, our program is free, there's no sign-up fee, and you get access to our Joes. And we have Joes that they'll text you, they'll call you, you can email and call them. Where's my appointment? I need to reschedule my appointment. They'll call you and say, hey man, your doctor ordered a CAT scan. It's been 3 months, you haven't scheduled it. Let's get that scheduled for you. They're kind of your wingman to help you throughout, to help you in any aspect. And we tell our patients, call us for any reason. We had one patient call us and said, hey, do you know a realtor in town? We need a good real estate agent. We just want to be that resource for them for every aspect of their life.
It's amazing. I thought I was thinking about an appointment. I'm like, oh, that was a year ago. And I looked in my records, it was 3 years ago or whatever. So that's so true. Hey, listen, men love to see that beautiful golf course, a downtown stadium, Cedar Point, you know, something like that exciting. And that's how I felt when I went to the Cutler Center. Just tell everyone who maybe hasn't been there yet what it's like.
Yeah, so our flagship location, and we have, our center is very much in person and virtual, but our flagship location, when you walk in, we're in the Drzezinski Sports Medicine Complex. So there's a 50-yard football field for rehab and training with, for physical therapy and all the different sports medicine. But on the third floor, we look down on this football field with a half a basketball court and a ballet bar and a batting cage. But up there, when you walk in, it doesn't feel like a doctor's office. There's a pool table right when you get off. There's a Zen area if you want to just kind of be left alone and kind of have more meditation feel. There's free coffee and water. And we have our Joes that will go and actually walk with you. We have no check-in desk. You come in and you meet with them. You can use a kiosk or talk with our Joes. They'll walk alongside you and sit with you, talk to you about programming, they'll even play a game of pool with you.
Yeah, maybe mentally it makes you feel better about being at the doctor. Before we go, any numbers you want to run through?
Yeah, so everything we're doing, we want to study it. We don't want to just say we have this interesting program. We actually want to prove to ourselves and others that this is working. And we have early data, and we're going to be publishing this, so I can't get into the specifics, but I can tell you what we found, that if we looked at Cutler members, and then we looked at men who are non-Cutler members, and we actually found very statistically significant differences between Cutler members and non-Cutler members in terms of how often they're going to the doctor. We found statistically improvement of screening for prostate cancer, and one of the most exciting is we found statistically significant improvement in diabetic control, which is really going to be unbelievable. More to come.
Yeah, more to come. I have a feeling we're going to have you back.
Look forward to it.
Dr. Lee Ponsky, thank you so much for being here.